Welcome to the Cardiovascular Pulse, where we dive into medical breakthroughs, leading technology, and healthy lifestyles. Join us as we empower you on your journey to a healthier and stronger you. Hi listeners, hypertension or high blood pressure may be a leading risk factor for strokes. Today I have Dr. Jennifer Rodriguez, Interventional Cardiologist at Cardiovascular Institute of the South in Meridian, Mississippi, here with us today to discuss the connection between hypertension and strokes. Thank you for being here with us today, Dr. Rodriguez.
Well, thank you for having me, and thank you for bringing up this very important topic.
Absolutely, absolutely. So as a whole, what is hypertension?
Very good question. People talk about it all the time, but what is it? Hypertension, otherwise known as high blood pressure, also known as a silent killer, and we'll get more into that. So your blood pressure is the pressure inside your vascular system through all of your blood vessels in your heart. Most people are familiar with it. It has two numbers. People call it a top number and a bottom number. The medical term is the systolic pressure is on top, the diastolic pressure is on bottom. The top number represents what the pressure in your system is when the heart squeezes, and the bottom number is what it reflects when the heart relaxes. And a normal reading is less than 130 over 80. If it's higher than that, it's too high.
Wonderful. And does this reading have to be done like multiple times or to be hypertension, or is it just one time right off the bat, if you reach these numbers, you have hypertension?
Very good point. We like to see at least two readings of it being high. And then you have to make sure that you're properly measuring your blood pressure. So to do that properly, you want to be in a state of rest, seated, legs not crossed, not talking, arm relaxed. And take it when you've been sitting for about 5 minutes or so. So often if you take it and it's high, we recommend that you rest for 5 minutes in that circumstance and take it again. Often when you come to the doctor's office, they're in a hurry, they're rushing you back, they're asking you questions, taking it at the same time. So if it's high, we usually recommend repeating it.
Absolutely, absolutely. And as you said, this could be a silent killer. What are some symptoms that people can look out for that they might just chalk down to everyday symptoms that are actually really big to look into?
So that's another good question. People often think that they'll know when their blood pressure is high. So they'll say, oh, I always know. I have a headache, I feel badly, I feel tension or pressure, all kinds of symptoms. But the truth of the matter is it is usually asymptomatic, usually not producing any symptoms. By the time you do have symptoms, it's usually extraordinarily high. And often people only check it when they're having a headache, for example, and they have no idea that it's high even when they feel fine. Symptoms for a hypertensive emergency or an urgency could be a severe headache, visual changes, chest pressure. And again, sometimes when people just don't feel right, it's a good time to check it. But you should also check it when you feel fine. Even people that are on medications under good control, I usually recommend a couple of times a week to check their blood pressure to make sure it's still staying in range.
Absolutely. And what are some ways that people can control it with some lifestyle modifications? What are some ways it can be controlled?
So nobody really wants to take medications, and so that's lifestyle modification is always what we want the most. The problem we run into is kind of two opposing truths. You don't want high blood pressure, but you don't want to take medications. And then the third one is I don't want to change some of the things I'm doing. But absolutely, lifestyle changes are a way to control it. So I divide things into things you can't do anything about, right? So if you're genetically predisposed to it, you could have high blood pressure. If you're over the age of 60, the vessels start to stiffen, particularly as we get into our 80s. 80% of people in their 80s have some kind of cardiovascular disease, and most of that's going to be hypertension. Those things you can't necessarily change, but the things you can absolutely do something about, lifestyle changes. We're talking about really the same things for heart disease in general. 3 things that are going to decrease your risk of blood pressure, diabetes, cholesterol, heart disease. We're looking at your diet, your exercise, and of course, things you're consuming like cigarettes, alcohol, and drugs, recreational drugs. So in terms of the things we're consuming, we want to avoid the salty foods. The American Heart Association recommends less than 2 grams. That's 2,000 milligrams. It's usually reported in milligrams. So less than 2 grams of sodium a day. Not everybody is salt sensitive, but most people are. And if you follow a low salt diet, it's equivalent to 1 pill. People will tell me, I don't cook with salt, I don't add any salt. I will tell you, if you never add 1 shake of salt to what you're eating, you're probably still getting more than the daily recommended allowance because it's already in the food. If you're eating out, if you're eating at church, that food is very salty. People always want to bring their best.
Very much.
Even sweet things, people don't
Right.
realize how much salt they have in them. So you really have to look at labels. If it comes in a can, you want to rinse off that salt. If it's preserved, like lunch meat,
Right.
a lot of frozen dinners, going to be high in sodium. I know that the Louisiana area gets a lot of hurricanes. I remember going through a period of time after a hurricane hit in the area where I was practicing, and all of my patients had uncontrolled blood pressure. And it occurred to me, and I started asking. They didn't have a stove. They were eating off of hot plates. They had a lot of prepared meals, canned foods, and so their sodium content was really rising. So if you can eliminate the sodium, reduce it, you'll bring down your blood pressure. Now, the thing about that is that you get used to the taste of salt, and so people get used to a certain taste. It's not that you need it. It's not that that's what's the right taste. Your body will adapt after a few weeks. And if you start reducing your salt, what you used to eat will feel too salty. So that's number one. That's equivalent to 1 pill. Something else is weight loss. Usually, on average, for every pound you lose, your blood pressure is going to drop a point. So if you have significant weight loss, you can bring down your blood pressure. And in fact, when I catch patients losing weight, and now there's a lot of medications, people are becoming a lot more successful. When I start noticing they're losing weight, I tell them, watch that blood pressure because it's going to start coming down, and now you're going to start losing pills. So you have to keep an eye on it from that. Smoking, excessive caffeine, excessive alcohol, and of course, recreational drugs, the stimulants like cocaine or methamphetamines, all of that will raise your blood pressure. When energy drinks first came out, I was getting a lot of young men in with high blood pressure for the first time. We figured out it was the energy drinks. So we definitely want to avoid those excessive caffeine intakes.
For sure. Those are absolutely wonderful symptoms to look out for. Everyday things that people can chalk down into just everyday things, and they're doing these things each day that they don't realize, even as far as the canned food and everything like that of the sort. And weight loss being 1 pill lower a day. I mean, those are some big things right there. And as far, you mentioned some risk factors previously. Are there other risk factors that people should look out for?
So people can have high blood pressure, as we talked about genetically. There are some circumstances that can cause it to elevate. So of course, stress, lack of sleep, sleep apnea, untreated sleep apnea. People don't realize, they say, I don't want to sleep with that mask. I don't want to get tested. I don't care how much I'm snoring. I'm not doing it, but it raises your blood pressure among many other things. So if you're not getting good quality sleep, that's another risk factor for it. We talked about the weight, the things that you can't change. There are some medical conditions and some medical therapies that can raise it. So decongestants when we get a cold, when we're taking steroids, for example, if we get sick and asthma or a serious lung infection, we might get put on steroids. The blood pressure can rise with that. If you're in pain, that will raise the blood pressure. So if you can't control your pain, your blood pressure may also become uncontrolled. So those are times when you want to look for it. Now, it is associated with other conditions as well. So it's not necessarily that the other conditions cause it, but if you have diabetes, high cholesterol, these are sort of running buddies, so to speak. You have the conditions that may also predispose you to high blood pressure. So that should be being checked by the time you know you have diabetes and high cholesterol. Also silent killers, usually don't have any symptoms till we're way into the disease. These are things you have to get screened for. So you need to go to see your doctor once a year for your annual visit, making sure that you haven't developed any of these conditions that are going to increase your risk of heart disease and stroke.
Absolutely. These are all good points that absolutely intertwine together that I know I didn't even know that they intertwine. Like you said, running buddies on the side of each other. And so what happens if hypertension is undiagnosed or untreated?
Okay, so the vascular bed in your body, that's the lining of all of the arteries and your heart, your vascular system. It has a skin on top of it that we call the endothelium. This is an active organ, just like the skin on the outside of your body. It tells the vessels when to constrict, when to relax. It tells them when to make clot, when to form clot. When you have high blood pressure, it injures the arteries. It injures that delicate and important lining that's performing so many functions. So if you think about if you're watering your flower bed and you increase the pressure on your hose, you start to put your thumb over that, you injure the bed, right? You start to see damage to the soil and the flowers and all of that. That's what's happening on the lining of your arteries, and your body is trying to heal it. Well, think about when you're injured and you get scarring and things start to get thick and tough. You get plaque buildup, and those are the things that set you up for heart attack and stroke. That's one of the things. The vessels the pressure can start to enlarge, stretch them out like an old pair of pantyhose. You can get aneurysms in your vascular system from that. The delicate vessels of the brain become injured that increase your risk for stroke. The other thing that happens is the heart muscle becomes weak. The heart is a muscle that is pushing against the bloodstream. Right. It's pushing against that pressure. So when you think about when you're, working out, against a heavy weight, your muscle gets bigger. Well, the heart will start to adapt by thickening, and that makes it stiffer. And then it becomes maladaptive. If you think about, if I gave you a dumbbell and said, I want you to do 10-pound curls, no problem. And then if I gave you a 50-pound dumbbell and said, now I want you to curl this, and you tried with all your might, and eventually you're going to fatigue out that muscle, and then I gave you a 10-pound dumbbell, you may not be able to lift it because the muscle is fatigued.
Right.
Well, that's what happens to the heart muscle. It becomes weak. You can go into heart failure and create all kinds of problems that way. So even though you don't feel it initially, doesn't mean that it's not creating problems.
Absolutely, and this is the big connection with hypertension and stroke, is what you said about the arteries. Is there anything that people can look out for when they're having a stroke, maybe like symptoms, and how this all intertwines together with hypertension?
Absolutely, and I do want to point out a couple of other things that go together. When you mentioned high blood pressure and stroke, high blood pressure sets you up for atrial fibrillation. Wow. Which is an arrhythmia that also puts you at risk for stroke. So you those are all things you want to think about. Again, the kind of things that come together, the running buddies that you can avoid by controlling your blood pressure. Now, the symptoms of stroke, because that's the number 2 cause of death in the United States, right? There's an acronym that the American Heart Association uses called FAST, like a fast car. The F stands for face. So you can get a facial asymmetry where one side is sagging. It doesn't look right. Maybe you can't, blink your eyes appropriately, things like that. The A stands for arm or limb weakness. So if suddenly your leg or arm becomes weak or numb, particularly if it's a whole side of your body, where just the arm and leg together, that's particularly concerning. The S stands for speech. So the speech may become garbled, slurred, or you may be unable to express your thoughts correctly. So you can think them, but you can't get them out.
Right.
Those are the symptoms. And the T stands for time to call 911. You don't want to wait out a stroke. The stroke symptom shows that a part of your brain is not getting enough oxygen, and you have got to get that remedied immediately. The tissues in the brain are very sensitive. They're the most sensitive in our body, and the damage can be irreversible. So if you're having any of those symptoms, and even if you have them transiently, where the face was, sagging, but now it's better, or the speech was slurred, but now it's better, you still want to get to the emergency room. You still want to begin treatment immediately, and we want to look for any associated conditions that may be causing you to have that. So
absolutely. People
will talk about a mini stroke.
Yeah.
That's not an official diagnosis.
Right.
We have transient ischemic attacks, TIAs. Those are strokes that correct. And then there's a stroke. It's just a stroke. The damage is done. It doesn't reverse. And so if you're lucky enough to have reversal, you don't want it to happen again. So this is not something you can brush under the rug.
Right.
Something else that's not listed in the acronym could be a visual change. So let's say a sudden blindness, or it feels like a drape suddenly came down over one eye and maybe it lifted. Those can be warning signs as well that we need to look out for.
Warning signs to address. Absolutely.
Always.
Always, always. Prevention is always key. So how can hypertension be treated?
Okay, well, we talked about some of the non-drug ways to do it with lifestyle, which are always paramount. So when you come to see me and we find out you do have high blood pressure, we confirm that. We're going to talk about those lifestyle changes, and you're going to implement them.
Right.
And some of them take some time to enact. In the meanwhile, depending on how high the blood pressure is when we meet, we often need to go ahead and start medical therapy.
Right.
And we don't want to drop the blood pressure immediately from 180 to 120.
Definitely.
We need to do it in a stepwise fashion over time because the brain and the kidneys have adapted to that high blood pressure, and I would put them in shock. So we have to slowly reduce it. So anticipate, I tell patients all the time, we're going to have a lot of frequent visits here, especially if it's very high, until we get this controlled. So we start medical therapy. We bring you back. We often have patients check their blood pressure at home, keep a log, and we use this to kind of monitor, how to adjust your medical therapy. That's one way we do it. Another way we do, some patients, I'm really excited about a program we have that's been so successful, especially with some of the trickier blood pressures, and that's home monitoring. We're in the virtual age. We can give patients a blood pressure cuff from here that communicates with our office. We have a nurse dedicated to monitoring that blood pressure, letting us know when the trends are not headed in the right direction or we're not achieving goals. And then we're able to kind of more proactively call the patient, get that blood pressure medication changed between visits so that we're not wasting time to get that blood pressure to goal.
The care that they need when they need it in 24/7, correct?
Correct. Yes,
24/7, 24/7.
All right.
Thank you so much for being here with us today, Dr. Rodriguez. That was very insightful. We definitely learned a lot about hypertension, risk factors to look for, and how stroke connects with it. Thanks for being on the show.
My pleasure.
We hope that this has empowered you on your health journey. If you have health concerns, visit cardio.com to learn more or request an appointment. Make sure to follow this podcast as well as CIS on social media for updates. Thanks for listening.